In a follow-up to that last video blog, in the discussion after Dr. Matthew Walker's talk, we had a chance to bring up some ideas about what's currently going on in the clinical environment regarding REM sleep issues and PTSD. And two questions that were unanswerable at the time that were brought up that were very interesting are, number one, antidepressant medication suppresses REM sleep, and yet many PTSD patients are placed on these antidepressant medications. So a very interesting question there would be, are these medications actually helping patients in some ways but hurting them in others because it's not allowing enough REM sleep for the patient to fully process their emotions? And of course, PTSD is clearly an example of a disorder in which there has been difficulty in processing emotional strife. The second point that came up was that in our research, we're showing that a lot of people with PTSD have sleep breathing problems. And of course, sleep breathing problems attack REM sleep. And in fact, one can argue that REM sleep is the most vulnerable to attacks by sleep apnea, which is why a fair number of individuals with severe sleep apnea often have reduced amounts of REM or highly fragmented REM. So we discussed this a little bit as well, because you've got two factors here. One would be the use of antidepressants. The other is the possibility of an undiagnosed sleep apnea condition, both of which could be having dramatic impacts on REM sleep in a trauma survivor. And if so, of course, we would want to get to the bottom of this to find out if this is actually influencing PTSD recovery.